Well, good morning, everyone, and thank you all for coming today. We all know that we just went through an education phase about how serious the drug problem and the addiction problem is in our metro region. So we're here today to discuss some plans, some ideas, and we're going to start out first with Mayor Mahoney of Fargo.
This is Mayor's Blue Ribbon Commission on Addiction. It is a public awareness effort to create strategies and recommendations for the prevention, treatment, and recovery of addiction. Mayors got together and decided we need to move this up to a different level. Our hope is to make wellness a reality for all people and families that suffer from addiction. According to the Center for Disease Control, addictive deaths are the biggest cause of accidental death. That is even higher than traffic deaths right now. So this has become an issue for our community and for the nation. Oftentimes when we have things that are issues across the nation, you have to figure out how to do it locally. So what we wanted to do is bring a panel together and talk about that. And we've gone to the outreach programs so far. There have been awareness programs and people are now aware that it's an issue. But what we haven't seen sometimes, and I've seen people in the audiences shouting out, what are you going to do about it? This is a call to see what people should do about this and get us organized a little bit. Because what might work in Gloucester may not work in this community. We may not have the same resources, the same people, the same ideas of what to do. We know our legislative team is working hard on this, have different things that are going in regards to that. We know our people that are treating people are doing things. But let's get together and figure out what the best treatment, best reason, or how to do this. Oftentimes when we do medicine, we oftentimes have a plan of care is what we call it. What would you do if this happens? And we don't think we have the optimal plan right now. We think we have to figure that out. We know what police and law enforcement do. We know what people do when they get into a program, but we need to do more than that. So we got together and had a little talk and said, hey, let's talk about this and see if we can do some different things. So this is what we're about today, and I'll let the other mayors speak as well.
This really is about people and their stories. It's about a mother that I met at an event that Amy Klobuchar put together. This mother had a daughter who was about my daughter's age. Her daughter had Crohn's, which is something I personally have. And she, like a lot of people, got into pain medication. And then when she couldn't get past it, then it became something where she went a different route with it with her friends. And in 3 months, she was dead. It's a story about the stories that we hear from recovering addicts who have been 5 years, 10 years, 15 years, and the stories that they tell about who they were when they were at that point. And then you see them at that point where they're just like anybody else, and you can kind of have that hope that they can be better, and the passion that those groups give to making sure that other people don't get where they were at. It's about the story about the community that we've been watching where people suddenly die. We've been seeing that a lot in the news, and those are people's friends, their brothers, their sons and daughters, and our whole community is excited about it. And frankly, it's about our youth is a key component of it. One of the things when I was listening to a number of stories of recovering addicts, I was just really taken by how many of them told the group that they started at 13. You know, it's a young age, and sometimes they would get past it, nobody knows, and then at a certain point it catches up with them, or sometimes it really happens at a really early age. And so this story about this commission is about our community. This story is about our youth, and it goes up the gamut to all ages, really. And so what we would talk about when we would go to a number of these events is it's interesting to hear the stories. You feel the compassion, you feel compelled, but it's time to start not just talking about the stories, it's time for action. And so I'm really proud to be a part of this commission. Thank you.
Thank you all very much. As we look at the face of addiction in the crowd, we can't see it. It's hard to identify. It runs the gamut between genders, social economic status, race, creed, color. It's unidentifiable. When the face does emerge from the crowd, it's very important that we as a community are there to support the individuals in need. I'm very happy to be a part of this. The city of Dilworth, during my tenure, I've been extremely blessed to see great collaboration, big city, small city. We tear down borders in Fargo, Moorhead, West Fargo, and Dilworth. We tear down the borders and we put out a hand to solve the problems that plague our communities. Right now, the problem is right now, our problem is addiction. We need to prevent the poisons that plague our streets, and we need to reach out with our hands and help everyone struggling with addiction. Again, we are fortunate to have this Blue Ribbon Coalition that is going to encompass every facet that we can imagine to ensure the greatest outcome to end addiction in our area. I look forward to the future of this commission. I think its goals are noble and just, and the men and women, whether it's our states, our counties, our cities, and most importantly, our trained professionals to help deal with this issue, when they come together, they will absolutely move mountains and provide outstanding results for our residents. Thank you, and I look forward to the future of this commission.
I'm going to kind of reiterate what they've just said too. You know, this is a great idea to put this commission together and start talking about this. A lot of people don't realize how bad or how much this is involved, even with the smaller cities. Being the mayor of Horace, you know, a lot of people don't think it comes to a small town, and it is. We've learned about this when we were at the League of Cities here last weekend about how prevalent it is. It's not just a big city issue, it's also a small city issue. We're close to the metro area right now, so it's nice to be able to get involved in this and help work with the metro to try and work on this problem. Because it does do the whole gamut. You know, it's not just the kids, it goes all the way up to middle-aged people and probably even older. So it's just something we need to do, and I think this is a great idea. I'm looking forward to working with the commission on this.
Thank you, Mayors. So, I'll try not to knock it down. So again, we went through this education phase, and now it's time that we moved ahead and did something about this problem as a group. And I'm proud that all the mayors have said, came on board to help us with this problem. We know that federal, state, and local funds are tight, and there are resources out there that are doing great work, but we know that their budget is very tight too. So the question is, how do we get all these groups that are doing really good work together and move forward as one? And again, we know that there are a lot of groups out there. There are a lot of resources, but we all have to get on the same page. And we have set a goal of coming up with a strategy by December, getting all these groups together and then moving forward. And it's a quick strategy to come up with. We're proud that Dakota Medical Foundation has stepped to the plate and said that they will spearhead this to get all the organizations together. What it means is if we can save one child, this effort will be worth it. If we can save a child the grief of losing a parent because of these drug addictions, it will be worth it. So I'm going to call on Pat Trainer to come up and explain how we're going to try to get all these groups together and try to get this strategy finished.
Thanks, Mayor.
Thanks.
I'm honored to be here this morning. If we could just start out with a moment of silence for all the families and family members, loved ones that we've lost to addiction and those struggling with it. If we could just start out with that moment of silence. Thank you. I'm honored to be here today and be a part of this commission. This is a community problem. It takes the entire community really to mobilize to solve this issue. This is not one nonprofit's responsibility. It's not one foundation's. It's not one city. It's the entire area. It's really our community coming together really around a brilliant strategy. And I got a couple of thank yous I want to make before I start. Carrie McLeod from Sanford, Ann Malmberg from Essentia. We've been meeting over the past several months. We met with Fargo Cass Public Health people. We visited with the mayors from the different cities. Other kudos to Kathy Hogan and our friend Judy Lee from West Fargo and Pete Silbernagel, who's here. People are concerned. This is impacted, addiction impacts every family, including mine. It's a serious, serious issue. We've met with law enforcement folks. They're in the room. They're dealing with the effects of addiction. So when we look at this Mayor's Blue Ribbon panel, we got to think about how are we going to prevent, how are we going to treat, and how are we going to help folks in recovery, because it's a lifelong struggle, recovery. So how do we mobilize the resources available currently to do a darn good job in all those areas, prevention, treatment, and recovery? You know, we've got great leadership within our healthcare institutions, with the other healthcare providers that, you know, they're too numerous to list. Fabulous people that are dealing with this. We got legislators that are very active, that have a keen understanding of addiction and what it takes and what the dearth of resources that are available and what we can do to use them and deploy them in ways we hadn't thought about yet. So this whole morning is about a call to action, citizens to come forward, leaders to emerge to help us on this commission. We didn't want to come out with a list today. We wanted to come out with an invitation to engage in this strategy that the mayors. Thank you, mayors, for calling us together, because I think it's a huge awareness issue. This is a crisis. So the U.S. statistic was 47,000 people in 2014 died of an overdose. But think of all the families. That's the worst possible result. But think of all the families that are struggling with this that don't end up with the overdose, because that's what gets reported. I'm talking about the struggles of families, people in the workplace, people that are kids that are struggling with, should I try this stuff or not? You know, on the prevention end, which we really need to get serious about preventing this and having a brilliant strategy around prevention in our community. I also want to thank Dan Molly with the City of Fargo, who's helped to orchestrate a lot of this and making sure that we communicate with everybody as mayors, because it isn't just, you know, what we talked about isn't just a Fargo issue. You know, we need to be super collaborative, so it's a Minnesota as well as North Dakota issue. So when I think of DMF, Dakota Medical Foundation was a hospital built in 1962, Dakota Hospital on South University Drive. Think of all the people that were treated with complications associated with addiction. Tons and tons. It makes perfect sense for the foundation to mobilize the resources of this community through supporting the mayor's commission, so we can have a brilliant strategy, so it doesn't drag out in terms of too many meetings, too long, so we can have some wonderful recommendations even before the North Dakota legislature meets in December. So that's going to take a lot of work. So Dakota Medical Foundation has hired a project lead. His name is John Vastag, who's with us today. And John has a great background, super background in legislative work, policy work with Sanford and the North Dakota side of the river in terms of the legislative affairs. Has a keen understanding of behavioral health through being a part of a task force on behavioral health across the region over the past 5 or 6 years. These issues, you know, are serious, but yet they're complicated, and there are a lot of players involved with that. Currently, he leads IPAT, which is assistive technology for folks that are recovering in many different, could be physical disabilities, any kind of disability, and the use of technology so they can lead a full life. So our job as a foundation will not only be to help John, you know, support John in leading the expert panels that will be assembled, but to keep the pressure on to come up with some great recommendations, preliminary recommendations by at least December. And then we know this will not be a project that ends. This is a huge, huge issue that we're going to need to measure. So data will be our friend, and we will be guided by what's working and not working, and removing the barriers so that we can be a model for the country on how we solve problems here in Fargo Moorhead, and hope to inform the legislature in both sides of the river. So it's my pleasure right now to introduce John, and then we'll certainly be available for questions. But again, we're grateful for the leadership right here, these mayors that have all been impacted by this terrible thing called addiction. And I really salute you guys for being a part of this and being active, because we need all the leadership in this area that we can get. Also want to thank Tim Seiler for attending from Essentia today. That says a lot, you know, to have a leader. And anyone else in the room, I want to thank you for being here. I couldn't mention everyone. Jeff Herman, where are you, from Prairie St. John's? Thank you for being here. And you've led these community forums, and we're grateful for your leadership, because really it's an awareness issue. Is a huge part of this, is the awareness. So thank you for being a part of it and for providing the care that you do in our region. John?
Good morning. I'd like to start today by saying thank you. Thank you to Pat and the Dakota Medical Foundation for stepping up and providing the resources necessary to have the Blue Ribbon Commission. And thank you to our mayors to recognize that this truly is a local issue. It's one that we can work with in partnership with our folks from the state government who we have worked in partnership, and they've done some great work. During the last legislative session, they passed some workforce initiatives that help addiction counselors become more engaged and to have more addiction counselors available. They passed the naloxone bill, the Good Sam bill. So we're working very closely with our state legislators and also our folks in D.C. But the reality is it's a local issue, and it's great to see the mayors recognize and understand that. As Pat mentioned, we're going to develop a structure of expert panels in prevention, treatment, and recovery, and we're going to work very hard at developing some very tough timelines to come up with recommendations by December. We'll have some initial recommendations that come forth that we can share with our legislator, leaders, and policymakers. But the reality is none of this is going to happen if we don't have great coordination and collaboration. This impacts all of our communities. It impacts the faith community, the business community, the nonprofits, the education community, medical community, and law enforcement. One of my friends at Dwayne Hodek, who happens to chair the Medical Association, told me when we started our task force on reducing pharmaceutical narcotics that if we got to law enforcement, we missed the boat. The reality is we missed the boat. We have an opportunity here to step back and take some real proactive action, get all of the collaboration we have. As servant leaders in our community, it's our job to bring really good practice to policy. We need to look at our policies and our practices to determine whether they are truly being practices and policies that enhance solutions, or are they adding to the problem. We need to make sure that we start with prevention, and prevention starts with each of us. As parents and grandparents, we need to look in the mirror and determine what practices and policies are we setting within our homes, at the city level, the county level, the state level, to make sure that those policies truly are ones that encourage good decisions and good outcomes. So we look forward to leading that, and Pat, again, thank you for the opportunity. I appreciate that very much. Thank you.
Thank you, John.
We will now, again, thank you everyone for being here today. We'll now take questions if you have any. You must have done a good job.
I know that you don't want to be specific, but give us some idea of some of the things that might come about from this, just examples that you might have.
Well, I know the schools are, and the education community is going to be part of one group. I think Pat probably has the answer there. I think there's 8 groups that will be formed. Each has their own area of expertise, and what we're going to try to do is get everyone on the same page and moving forward from there.
Try to figure out what the best way to treat addiction is, what modalities you use, how many hospital beds do we need, what else do we need in counselors. Addiction counselors are an issue sometimes, getting enough addiction counselors in the state. So it's kind of making awareness, what do we need, what data supports this, and what do we need to do. The only other thing I had to mention is I made Rich bring Sandy's Donuts here today, so please, before you leave, grab one and take it with you.
My special request.
Dan Wally reminded me that's not real healthy, but you know, sometimes we have to have a little treat. Chad, you have something?
I want to say thank you. I think it's very important as I get the phone calls from across the river. This is so very important, as everybody knows that addiction doesn't stop at the Red River. This is a Fargo, Moorhead, West Fargo, Dilworth, Minnesota, North Dakota, Cass and Clay County. The legislation, Horace. Fine, sir, pardon me. That's how I felt for years. The legislation and the ideas and the policies that we create have to transcend borders. We cannot look at a person and say, where are you from, and have that determine a level of treatment or an opportunity that they get to have. Oh, it's essential that everything we do includes everybody. And I think we have great leadership across the board to make sure that happens. We have a tradition of that, and I'm very fortunate and very positive that we'll continue to see that as we go forward.
And Mayor Williams and I have talked the problem with Narcan, how do you get Narcan kits out, what can you do in North Dakota, what can you do in Minnesota. So it's oftentimes bringing those groups together and trying to figure out how can we do this better. I have my firemen with Narcan, and with West Fargo, police take out the medical calls. So it's kind of a question, what's the best way to do all that? And truly we have to figure out what works best. Have more saves, I guess we would say, Rich and I call saves, and get them into treatment. But as we learned from the addicts when we went to a meeting the other day, it's a battle every day. So the different in drug addiction versus alcoholism. And alcoholism is quite often you say you want to drink, and somebody says, yeah, I want to drink, but that's not what I should do because I know it's going to give a problem. Narcotics seems to be more seductive. It's very, very hard to break loose from that. So we may need to do medical treatment as well, in which people are able to have injections or take piss medications and are monitored and watched and work together. So there's a lot of different modalities on that. On the medical side, as a surgeon, I usually talk to people about pain. How are we going to handle pain now? So it's a question, Rich, you're going to have something done. How will I handle your pain? You want the high drugs, low drugs, middle drugs. But what happened is the 5 vital signs in a hospital, one of which was pain, everybody wanted to have that smiley face. They didn't want to have any pain. Maybe we have slightly grumpy face, where your pain is managed, but you're maybe not in la-la land. So I think you have to have that discussion with people now. And all the medical rules, we're now talking about how much narcotics you give out. And I have to say the biggest drug eating machine is a toilet. I don't know how many people call you and say, Dr. Mahoney, I lost my medications on the toilet. It's like, do all go in the bathroom to take our pain pills? I don't think so. But I think it's a whole, what Rich and I talked about, it's the whole, look at the whole picture, the whole big picture. And Delray and I talked about people having narcotics in their house, and people come into your house and check your compartments and grab a few of the Narcan or whatever is sitting around. So one of the things the mayors, we have asked out there is maybe look in your medicine cabinets and see how much drugs you have that you probably don't need. And I was just remarking to Rich here, he's got a drug drop-off box right here in City Hall. I think we're going to put one in, we have one at the police station, but we might put one in City Hall as well. If you need to get rid of your drugs, get rid of your drugs. But kids are finding them, and I always loved it. Somebody said, Tim, you got some good drugs, and I gave a guy a tablet and told him, yeah, this is really good. What he didn't know was a Tylenol, but made the person feel good, so. It's a perception, and so kids sometimes try a drug just to see what does it do to me. So I think that's an important part of it too.
I think one key strategy will be how do we maximize the effectiveness of all the current providers? So how can we really help them to reach their full potential to serve? And that's a whole range of things that you need to brainstorm with folks and be transparent, be very courageous in terms of bold innovation. So that will be one thing, because you do have access issues. You have awareness issues for how to navigate systems in terms of treatment. And then how can we change culture relative to prevention? There will be a lot of different strategies, starting with even before the schools, with parents and educating folks so that we're looking at the whole thing with prevention. How do you change the culture so this isn't part of it? So people don't ever try drugs and people don't get into the abuse of alcohol and other substances. So I think you look at each one of those, and they mention the folks, but at all levels of government being involved, so city, county, U.S., federal, state, all levels, how can they work together, not off by themselves, but work together to maximize the effectiveness of what's currently going on and what's currently being deployed, in terms of the government entities. And then you have the nonprofit entities. So what can we do to help these nonprofit entities reach their full potential to serve? Then you have businesses. And I think that businesses play a role in this, and there's innovative recovery programs that are in Fargo that work right with businesses on helping and providing a funding model for the recovery situation. And I think law enforcement has some great ideas. Law enforcement is represented here today. I want to thank you guys for being here. But they have great ideas of what we can do. The state's attorney, the U.S. attorney, the local police, you know, they all need to work together. So you can see how complicated that is, how many, when you ask for specifics, that's very difficult. And part of the commission is that you bring the community together, great, smart people that are working in this area to develop those.
Pat, if somebody wants to get involved, like a business or a group, contact.
We should contact anyone that wants to be involved. And again, this is a call to action for folks that want to be involved, citizens, people in nonprofits, government, businesses. That would be John Vastag, and he's at IPAT. So we'll definitely have that number available.
Just a couple other things you'd asked, what's some specifics. Well, a couple things that have happened that have really been on the right track are our take-back programs. About 4 years ago, when we started our task force, there were 13 take-back locations, one of which was just down the hall here. And if you go outside here and down the hall, you'll see that take-back location. We are now one of the few states in the country that actually have a take-back location in every county in the state, which is open 24/7, 365. Also, due to recent federal regulation about a year old, we now have the Yellow Jug program. And within a short time, thanks to Dr. Hardy and Senator Anderson and folks here, our legislators here, we will soon have 100 local pharmacies that will have the Yellow Jug within their pharmacies to take back drugs. So we're moving forward with current legislation. We have one of the best prescription drug monitoring programs in the country. Our providers are looking again at their prescription practices and reviewing how they do that. And so there's a lot of proactive things that are happening in today's environment. We just need to make sure we build on those things that are happening and continue to improve the atmosphere. We are in a state of crisis, and Fargo's and Moorhead and our communities have been in a crisis before. But the reality is, when we had a crisis in our community, we rolled up our sleeves and took whatever it needed to get done to get it done. And we will get this done. It's just a matter of collaborating and pulling our resources together.
Any other questions?
Do you know if there's other commissions like this across the nation?
Not that I know of, but there probably is, but I don't know.
We'll have to Google it.
Yes.
We've run a bunch of stories about the opioid addiction problem, and one thing that keeps popping up on our comments and stuff is like the lack of the treatment facility and the cost of treatment. Is this commission going to do anything to tackle those things?
John?
That's a great question. Thank you for the question. Certainly that will be one of our recommendations. As we know, funding is typically a major challenge along with workforce. And currently, as I mentioned earlier, our legislature passed some initiatives that would enhance the number of addiction counselors available in our communities. But it's going to take much more than that. It's going to take resources. We know that. It's going to take a lot of resources on the prevention end. And if we do it right, as in any crisis, we spend a lot of resources reacting to it and taking care of that. But the reality is, at the same time we're reacting and taking care of it, we're also working on a prevention plan. And if we do this right, we should be spending in the next couple of years more time on prevention than we are reacting. So there are things that need to be taken care of immediately. Absolutely. Some of that is workforce, more access to treatment, but that'll be part of our recommendations that come forward.
And actually, your point is well made. It's a concern we have is you get through a crisis, you detoxify somebody, and then they can't get in a treatment center. You discharge them and say go to a treatment center 2 weeks from now. And it really puts that addict at high risk to recur. So that's what, and many of the stories you've seen, I've seen, is somebody who's close to something and all of a sudden isn't in a treatment center, ODs and dies. So that's one of those things that we would talk about. What is the best care plan for those people, and what should we have set in place? And it may be involving recommendations to the insurance carriers as well. So that would be the thing, and then legislatively, we may want to look at some things as well. So the idea is bring back the recommendations. What's the data? What are we finding out there, and what are the needs, and what do we recommend to fill those needs?
I'm just going to add one thing that I know a number of people have talked about that hasn't been brought up here. A lot of it has to do with aftercare. It has to do with when you've prescribed somebody that dosage of pain pills, and I can tell you, I have a fair amount, I get a fair amount, I'll take one, and then I'm done with it. You know, I'm that kind of person. But those that need it and feel it, when they've been taking it and then go off of it, that aftercare in sort of a follow-up kind of way to make sure that they're not at that point. So they're not at their point where they're looking to their friends and trying to figure out how do I get more, or how do I shift to heroin because that's the cheaper version of it. That piece needs to be part of the medical thing. So I bet that will be one thing we probably will see, because I hear that one a lot.
One other piece of legislation that was passed last year was our voucher program. Through the Department of Human Services, Medical Services, individuals can access the voucher program. So it's just another avenue that, again, we've been working on at the state level, and that is now in place, and we have a number of providers that are actively using the voucher program, but it certainly could stand some more use.